What is pelvic inflammatory disease? Pelvic pain? Don't wait. It might be pelvic inflammatory disease striking. Don't let pelvic inflammatory disease climb. Catch it before it reaches your fallopian tubes. Pelvic inflammatory disease, the hidden culprit behind infertility. Ascending infection of the upper genital tract, uterus, fallopian tubes, ovaries, and peritoneum, usually following cervical infection by Neisseria, gonorrhea, or Chlamydia trachomatis. Pelvic inflammatory disease causes, symptoms, and treatment. Neisseria, gonorrhea, Chlamydia trachomatis, Gardnerella vaginalis. Risk factor: multiple or new sexual partners, unprotected sex, previous pelvic inflammatory disease or sexual transmitted diseases, infection, age less than 25 years, vaginal douching, intrauterine device insertion within first 3 weeks. Signs and symptoms. Pelvic inflammatory disease typically present with pelvic or lower abdominal pain and cervical motion tenderness, also called the chandelier sign, because the pain can make the patient jump like grabbing a chandelier. You may also see fever above 38 degrees centigrade, abnormal vaginal or cervical discharge, adnexal tenderness, painful intercourse, dyspareunia, painful urination, dysuria, irregular menstrual bleeding. Complications include tubo-ovarian abscess, fever with an adnexal mass on ultrasound. Infertility due to tubal scarring, ectopic pregnancy from damaged fallopian tubes, chronic pelvic pain because of adhesions, Fitz-Hughes syndrome, perihepatitis causing right upper quadrant pain with normal liver function test and violent string adhesions between the liver and diaphragm. Diagnosis is mostly clinical based on symptoms and exam finding. Supportive investigation include elevated ESR, CRP, leukocytosis. Positive NAAT for gonorrhea or Chlamydia trachomatis. Ultrasound may show tubo-ovarian abscess or free fluid. Laparoscopy key to early pelvic inflammatory disease diagnosis and treatment. Laparoscopy is the gold standard but rarely needed. Treatment of pelvic inflammatory disease. Always treat empirically, don't wait for culture. Ceftriaxone 500 mg intramuscular single dose plus doxycycline 100 mg per oral twice daily for 14 days. Plus metronidazole 500 mg per oral twice daily for 14 days. Ufloxacin 400 mg BD plus metronidazole 400 mg BD for 14 days. Levofloxacin 500 mg OD plus metronidazole 400 mg BD for 14 days. Admission. Indication for admission include pregnancy, cannot tolerate oral medicines, severe illness, high fever, nausea, vomiting, tubo-ovarian abscess, no response to outpatient therapy within 72 hours. Abstain from sex until both patient and partner complete therapy and are asymptomatic. Treat all sexual partners from the past 60 days for gonorrhea and chlamydia. Thank you for watching. Subscribe for more videos.